Hello, welcome to a bank holiday weekend. My name's Toby and I'm making this short film about Operation Mary Seacole, which is our response to the COVID-19 pandemic. So first of all, of course, thank you. Thank you to your loved ones, your friends, your family for supporting you. Thank you to you for the work you're doing to support our patients, and thank you to our patients and their families for trying to support us in what is going to be a marathon, not a sprint. So I wanted to explain a little bit about what we're doing inside the organisation. It's really a story in two parts. On the one hand, we're expanding a lot of the facilities that we have. We've got more wards open than we've ever had before. We're making 4 times bigger our critical care unit. And on the other hand, we've run a huge programme of testing staff. Now we're testing other care workers, and then we're going to move on to testing key parts of our local population as part of trying to build a local Ladywood, Perry Barr and Sandwell exit strategy from the surge. But make no mistake, this is a hugely difficult, a hugely troubling, a hugely emotionally burdensome situation. It's one we're going to be living through for some considerable time to come. So thank you too to the businesses who've stood with us, to the volunteers who've worked with us, and to all our partners across our local communities. Remember, there are 4 parts to the plan that we've got internally. So firstly, you might be working in an area where suddenly you've seen lots more staff join you. That takes a toll on yourself. There's an expectation of mentorship and support that we're asking of you. Or you might be somebody, a doctor, a nurse, a neurophysiologist, a cardiophysiologist, who's been asked to relocate, to change what you chose to do and to go and work temporarily somewhere else. Please make sure you go to the training, you fill out the forms we've asked you to fill out, setting out what you do and what you feel you don't know. And then thank you for changing your working pattern to try and make this situation tolerable for all of us. There's a group of people working day and night trying to manage this situation, trying to fix problems as they arise, deliver masks to other hospitals who've run out, find the right balance between the Nightingale and here, make sure we're supporting each other across the organisation. Thank you to all the on-call managers, the exec teams, the clinical leaders who are taking that responsibility and making those difficult decisions. And then finally, there's a big group of people who are joining our brigades. Those are people who are volunteering to step into different roles, maybe as porters, as PPE marshals, as cleaners, as transport drivers, to support us to make sure that our clinical staff can focus just on the patients and on direct patient care. And meanwhile, we can try and make the places where we work as civilised, as clean and as decent as we can. It's a massive effort. So I need to remind you, you need to wash your hands 20 seconds many times a day. I'm stood at least 2 metres from this camera, but I still see colleagues close to each other when they're in the sunshine having lunch. Please remember your social distancing. Consider whether now is the time for you to move into a hotel. Keep yourself safe, keep yourself working. Make sure you've had a look at your roster pattern and can work out when you're going to get a break. And maybe by adjusting your plans, help someone else get a break. And I guess most importantly of all, let's make sure that this is an approach that we have that's distinguished by its kindness in how we treat each other and how we look after ourselves and how we look after, most importantly, our patients. It's a very worrying time. A smile, a look, a name, an introduction can go a very long way. Let's give each other just that little bit more time as we move through this situation. I'm fiercely proud of the work that we're doing. Let me know any problems you're having, any concerns, any ideas. We're all in this together. One team, teamwork. We'll do our best to get through it. Thank you.